But let me introduce Dacy Reimer. Dacy's a longtime friend of WPA. Dacy's a nurse practitioner at Neuroscience Group in Neenah, specializing in the diagnosis and treatment of movement disorders and dementia. She is an author and a certified research coordinator, and she has managed more than 30 pharmaceutical studies using experimental therapeutic agents, many approved today for use. Welcome, Dacy.
Thank you, Gary. I appreciate you guys having me today, and I wanted to just say really congratulations, because I think that the WPA has done a great job during this time in being able to acquire a really fantastic video library for people with various topics and resources for Parkinson's disease. So even though we can't meet in person, I think that this has been a really great way for us to start a new platform and share this information. So what I want to do today is talk a bit about some of that sharing. And since we can't get together as support groups and get together even as friends to share as much, it's even more important to make sure that we're sharing some tips and ideas and knowledge on Parkinson's disease. So my talk today is kind of pearls for living with Parkinson's. Next slide, please. So you can kind of see in this heart, there are a lot of terms that we tend to use. And I tend to say, well, you know, sharing is caring. So you may have certain needs. You're identifying your friends. There are offers for help. It's really important in this time that you reach out and identify those different areas that you are lacking in knowledge, so that you can acquire that information and make everyday life a bit easier. Next slide, please. So what are some of the things that we can share? Well, diagnosis. I've got many people I know that are newly diagnosed in my clinic that are tuning in today. And maybe you've had Parkinson's for 20 years, but you know what? The reaction at the time of diagnosis is really the same. So we can share those reactions. You can share knowledge, you can share tips on daily living, and you can share those emotions as well. Next slide, please. So pearls for diagnosis. You know, not everybody reacts the same. I have had patients that said they were shocked, you know, when they got the diagnosis. Others that felt very weary and uncertain. Some were happy to know what it was. They knew something was going on and really couldn't put their finger on it. Some people feel like they could accept it pretty quickly and carried on with their day. Others felt like they were very slow to accept the diagnosis. Some felt very confused and uninformed. So I feel like the biggest key is that you identify your supports, whether it's family, friends, church. You seek credible resources. Clearly, the WPA is one of them. You make a list of your questions for appointments and bring them in. For me, that's very important. And that you clearly stay connected to the community, the Parkinson's community in particular, and not shut yourself off from other people. Next slide, please. So what are some of the pearls of knowledge? Well, those are some of the things that I feel like I'm responsible for in my clinic visits. The fact of the matter is, I put a lot of that back on the individual. I really stress that this is not something that you read and you see the prognosis for in writing in the medical literature, and you go, okay, well, that's where I'm going to be. No, you really help to shape your prognosis. You play an active role in this. It matters if you exercise. Exercise makes you stronger, and obviously we've got more on that a little bit later today. Being sedentary is going to make you weaker. You are what you eat. What you put in your body does matter. Your mood impacts your mobility. That old adage of, you know, your body follows your mind is very true. and your sleep will definitely impact your mood. So keeping in mind that if all of those are negative in your life, so if you are sedentary, you're not eating well, your mood is bad and you're not getting good sleep, well, guess what? Your prognosis is not going to be as good. You're going to have to put a foot forward, an effort forth to change some of those things, and it definitely will change your prognosis. Our goal is independence. I tell that to every one of my patients, and I believe it for myself. But independence doesn't mean you do it alone, right? It means that the goal is that you stay in your own home, right, as long as possible, and it may require asking for help. It may be that you have to seek outside resources. It may be that in order to stay in your own home, you need to have a little bit more help with shopping or cleaning or some of those other things. So it may mean that you need help. You need to identify those resources, especially since so many of you are coming from different areas. I can't give you specifics on who to call, but definitely your Aging and Disability Resource Center, the ADRC, for each of you locally in your county is a great connection and resource. There are booklets out with phone numbers on various community resources, and they're also, they have a website as well. You will also, as you're going along, may need a device to be able to stay home and independent. Well, you know what? I guess there's a certain amount of acceptance that needs to come with that as well in order to stay in your own home. So learn more about Parkinson's disease. Ask questions at your doctor's visits. Seek material here through the Wisconsin Parkinson Association website. Like I said, they've got a great library now. It's a great resource. And again, try to attend your local support groups as well. Next slide, please. So I kind of pushed through that because I want to get to the meat and potatoes here today. Not that I really promote meat and potatoes. If you've listened to any of my other talks on nutrition, I really don't, but you know what I mean. So next slide, please. My goal with this talk was really to equip you with a few of the pearls that I talk about in clinic, and maybe we don't always cover in some of our educational materials. Maybe some of you know these things, other people may not have these resources, but if you can walk away today with even one pearl or idea or tip that helps to make your everyday life with Parkinson's a little bit easier, well, then I feel like we've been successful today. So one of the things I wanted to talk to you about is something I run into clinically. When we're talking about Parkinson's, one of the things is reducing costs, right? Nobody wants to fork out too much money for medications. And there are ways that you might not know are available to try to reduce some of those costs. So one of the things is sit down annually and look at your Medicare policies. Oftentimes that can be done through your Aging and Disability Resource Center as well. And they can help you to identify, well, what medications are you currently on? It may be something to talk about during our clinic visits too, and projecting forward for the next year. I've had patients come and say, well, do you see this regimen changing? And of course I can't forecast, and I don't have a crystal ball, but I can give an idea of how stable that person has been and any considerations that might be in my head for the future that we might want to consider for medications, and they might want to make sure that that's included tier-wise on their plan. So check with your insurance on what covered pharmacies there are. Shop around for pharmacies as well. Many years ago, we did an article for the network newsletter through the WPA, looking at the various pharmacies with all the different Parkinson's medications. And the take-home message from that article was that there can be a $200 difference in medication prices from one pharmacy to another. So they really do vary. You may have a pharmacy that you really like because you know that pharmacist, and you feel like you get a lot of good information, and that's fantastic. But it may be that you need to shop around for prices, especially if you're talking to other people and they don't seem to be charged the same as what you are. So it does pay to shop around and price shop for medication. There is something that's also called a tier exception. So when you are looking at medications, they are ranked on tiers, and those tiers help determine the price of that medication. And I apologize, my dog is going to bark in the background. So those medications, those tiers are able to change, but we have to go through a few hoops and ask for what's called a tier exception. So say your medication lands on a tier 3. We can apply for a tier exception, and that's done. You can do that directly through your insurance, and then I would have to call and help support that and justify why I feel like it's acceptable. So for example, a person who is on Mirapex, and that medication has really helped their tremor. The other medications maybe that we have tried haven't worked as well, but your insurance likes them better. We can ask for that to be moved to a tier 2, and we can only go up 1 tier. They won't let us jump from like tier 3 to tier 1. So a tier exception will allow us, if approved, to justify why that medication should be covered at a better level. So it's a lot more work, of course. There's some hoops to jump through for me and for you, but if it in the long run helps to be covered better, then it's something that I'm willing to do for my patients. So you can get what's called a tier exception. Also, you can see if you qualify for any types of assistance programs. If you go on Medicare.gov, there's a section where you can actually input your medication. So say you're trying to investigate the option of the Nupro patch. It's a patch that you put on. It's a 24-hour patch. It's a dopamine agonist. And I'm only using that as an example because it tends to be expensive out of pocket. You can go on there and they'll give you an idea of where you might be able to get a better price for it. And usually they tend to guide you to what's called the Patient Access Network, or PAN program. But you can use that, that site to look up medications and see if there are any assistance programs. Also, the pharmaceutical company that is the sponsor or the owner of that medication, most of them offer what's called indigent programs. And indigent programs mean you have to meet a special financial requirement of an annual income to qualify. Again, it's a bit of paperwork, but if it covers it better and it makes it to where you are able to afford it, it's worth going through that work to actually get qualified. There's another program that's called Goodrx. Goodrx is a card that I give out to my patients. It's always worth a shot. I don't always know if they'll qualify. There are many, many different medications. I'll kind of try to put this up here a little closer. So it's called Goodrx. There are many medications that can be under the Goodrx program. So you might find that even your spouse's medications qualify for it. That card is a one-time card that you can take into your pharmacy, and they can run any of your medications through that card to see if you can get a discount. They have a website that you can plug in the medication that you're taking, and it'll actually give you a price based on, and you put in a zip code, so it'll give you a price at each pharmacy. So you might find that Pick and Save is, you know, $100 cheaper than Sam's Club or something like that. So it's worth going on their website to check your prices as well. There is a program called Prescription Hope. Prescription Hope is a bit different. Again, it's an annual income qualification, and any medications that qualify for that program, it's $50 a month. So any medication is $50 a month. So it's a flat fee. Again, you'd have to qualify for that. And then there is the program called the Patient Access Network Foundation. Some of the newer medications, a lot of the newer medications have patient assistance programs. And so it is something that I talk about. And if I'm going to switch a person to a new medication that has a patient access program, I do it, I sign them up and I get the paperwork rolling that day in the office, because I don't want you to have to be paying out of pocket and more money than what you need to for those medications. So hopefully that information is helpful to you. Next slide, please. So on the topic of medications, I just wanted to kind of give some tips on some things that I make suggestions on, as well as suggestions from some of my patients. Managing medications, especially with Parkinson's disease, we're talking about a minimum of 3 times a day, right? Carbidopa, levodopa starting dose is 1 pill 3 times a day. So the numbers can kind of go up from there. So it can be tricky to remember to take the medication and get accustomed to the routine. If you're dealing with memory issues, it can be even harder, and you become more reliant on care providers to help with managing medications. But again, our goal is independence. So what I tend to suggest to people is set your medications up ahead of time to avoid any missed or overdoses. You can use a pill box. Now, there are many, many, many different pill boxes. You know, there are your weekly ones, but this isn't going to help a lot if you take medications 3 times a day. There are some that are set up for multiple times a day, obviously. Another pill box that actually I used for my grandmother, who we called her Mama, she was starting to make some errors on her medications and things. So I would go to her apartment weekly and set her medications up. And there are many different types. And I encourage you to talk to your pharmacy or even a durable medical equipment store, even do some research online. This one is the exact one I used for my mama. And it's an electronic one. And you can see that it's set up with a whole bunch of slots. So depending on how many times a day you take your medication, you can set this up for at least a week. They have timers on it. You can see that there's little, there are little instructions on here on how many times a day, and this slips into the slot. And so you can set it up. So this one is set up right here for if you were to take your medications 4 times a day, which many of you do, you can set this up for a whole week and it will alarm you. And I'm not going to make it go off right now because it's really noisy. So what it does is there's a slot you can see that only allows, I've got it in the middle, that only allows 1 dose to come out at that time. So with my mama, she was having some problems with trying to, she wouldn't remember if she took her dose. She at times took too many medications, so it would only allow that dose to come out at that time. It would sit next to her chair, it would beep. In order for that beeping to go off, she actually had to turn it upside down, take the medication, and then the beeping would stop. So it'll be annoying until you actually stop it. It comes with a solid lid like this or a clear lid so you can actually see all the medications. For her, seeing all the medications overwhelmed her. And so having the solid lid kind of narrowed it down. It actually said it says on the opening if it's Wednesday evening or what dose that it is that they're taking. So I just thought that I'd kind of share this with you. It comes with instructions, obviously, on setting it up. It might be something the spouse has to set up or one of the kids need to set up. It requires batteries, of course, but you can at least set up multiple doses and keep that person as independent as possible with taking their own medications, or at least feel a little more rest assured if somebody is having some errors with their medications, that they won't overdose on on them. Another option is bubble packs. I have many patients who use bubble packs, and that's packed by the pharmacy. There's a fee for that, of course, but if it keeps you safe and if it seems like it is less confusing for your medications, certainly bubble packs are an option. So talk to your pharmacy about that as well. Those are usually sent to the home either weekly or monthly. It depends on the pharmacy. If medication changes are done, I send them in, the orders into the pharmacy. They either come and retrieve those packs and refill them for the updated dose right away, or you have certain days of the week that are standardized that new dose would be adjusted to. If swallowing pills are a problem, a few tips on that. Yeah, obviously make sure you take a sip of water first. You can also use applesauce or Greek yogurt. Talk to your provider about other medication options. And many people don't really know this, but because you're on a dose of medication, you might not know what all your options are. Especially if you're on carbidopa, levodopa, there is a formulation of it that is an orally disintegrating, meaning you can put it in your mouth. You don't need any water. It'll just melt in your mouth. And so that's an option. There's another formulation of carbidopa, levodopa that's a longer acting formulation called Rytari. And that comes in a capsule, but that capsule can be opened and it has kind of little sprinkles, and that can be taken with applesauce or Greek yogurt as well, and make it a lot easier to swallow. There is a transdermal patch that can be used. The immediate release carbidopa, levodopa can be crushed, but the extended release cannot. It can be broken in half, but it cannot be crushed, otherwise it becomes all immediate release. And then there are other rescue medications such as Apokyn, which is an injection, Imbresia, which is an inhaler of levodopa, and then a new medication called Kinmobi, which is a film that dissolves in your mouth. Some of these tips, the reason why I'm giving them to you is obviously there can be swallowing issues, but these can also be options for people who are in the hospital. So sometimes you might find that the swallowing changes, or you're wondering, well, how do I stay on my medications even though I'm not supposed to take something by mouth? These are options that I think you should just at least be aware of. And if you're planning for a operation or anything like that, and you need to be able to stay on medications, it's a conversation to have with your provider. If you're finding that you have a loved one who is in the hospital and isn't taking medications, these are certainly things that I switch to if need be. Next slide, please. So levodopa can improve swallowing. So that's one of the things that I use as a treatment criteria or treatment goal. So it's really important that you get the levodopa. Obviously, that's why I was talking a lot about getting the medications. If you're having problems with swallowing and you don't get the medication in, well, guess what? You're going to have even more problems with swallowing. Not everybody has as an issue, of course. It's important to know when your medications kick in or when they are working at their best, because you don't necessarily want to eat when you're in an off time. Now, not everybody has that. Not everybody experiences what we call off times. Off times are times when medications can be less effective or your symptoms come through more. And so it is important to make sure that if a person is having swallowing problems, that when you go to eat a meal, you're doing it when your medications are kicked in. And the only way you kind of know that is to know your medication and know how soon that medication actually works. So if you take a medication at mealtime, say at 8 o'clock, and you're trying to eat at that same time too, well, guess what? It got it in you, but it's not active and working yet. So you might struggle more through that meal. You might have more problems with actually swallowing. So you might want to take it a half hour to an hour prior to the meal to make sure that that swallow reflex is there and you're less likely to aspirate. Obviously, eating when you're tired is not a good idea. You may need to move your main meal time to noon instead of the evening if you find that you're more fatigued or tired in the evening. Avoid hard, dry, or crumbly food. Those tend to be kind of particly, and I always hear from my patients that those are the foods that give them the most trouble. Take your time to eat. Make sure that you're in a space that's comfortable and quiet, that you don't feel like you're rushed. It can take longer to eat, so consider more frequent meals or smaller meals or foods that are easier to eat. You can always get heated plates as well that can help try to keep the food warmer longer and more palatable as well. Make sure that if you are having swallowing problems that you report that to your provider. You might not think that's even part of your Parkinson's. I hear that frequently, but it is something that would need evaluation. It might need a speech therapy referral. They can do a bedside swallow study or we can order a video swallow study as well. And then one of the tips that I tend to use for my patients is if you're having problems with swallowing, or you even wake up in the morning and you feel like there's a lot of phlegm in your throat, a lot of frothiness in your throat, I tend to tell them to use what's called an incentive spirometer. And this is one of those plastic things you get when you're in the hospital, and it has a ball in there. And we use it in the hospital to make sure you don't get pneumonia. And so you blow into this thing and you're trying to make this ball go up, and you're blowing out as long as you can and trying to keep that ball up there. Well, what that's doing is making your diaphragm push all that gunk out of there, and it's going to clear your airway. So if a person is having a lot of problems with swallowing, I tend to tell them, well, use it 3 times a day, especially after meals, so that you're clearing all of that out of there and it's not just resting in there. If you're a person who has a lot of that phlegm in the morning because you have a lot of extra saliva and it tends to accumulate during the night, use it in the morning, clear that gunk out of there, and use that spirometer to help clear the airway so it doesn't settle into your lungs. I had one woman in particular who, when I was in Milwaukee, was in the hospital practically every month with pneumonia, with aspiration all the time. And I kept making this suggestion to use the spirometer, and I'd give her a prescription for it. And when she started using that, she really improved and really it was like once a year she was ever in the hospital, and Lord knows we don't want anybody in the hospital. But if you can do something every day to decrease your chances of any pneumonias, we certainly want to give you the tools for that. That might require a prescription if you don't have one. Next slide, please. Water is really important. Some of the main things we run into is constipation, dizziness, and confusion. So your brain's 80% water. You've probably heard me talk about this in the past. Make sure that you're increasing your water intake. Next slide, please. You can add flavoring to that water. You can switch from soda to sparkling water or mineral water. I just want you to avoid added sugars. Make sure you sip it, don't chug it. One of the reasons why people avoid water is because they're afraid of having to go to the bathroom more. Well, if you sip it, your body absorbs about a Dixie cup of water every 30 minutes. If you sip it instead of chugging it, you won't overtax your bladder and have to run to the bathroom so often. One of the things you can use if you're having problems remembering drinking water is I've got this wonderful cup that you can light up, and it'll remind you to drink every half hour. For people who are having memory problems, a lot of times caregivers say, well, I can't get them to drink more water. Well, give them a popsicle, a sugar-free popsicle, and that's a great idea. It's kind of slow release, obviously, with water, and it'll help them to stay hydrated more. Next slide, please. Bladder, obviously, I just mentioned about decreasing the amount of water you drink at one time. To avoid that urgency, especially when you're drinking too much water during the day, it's smart to get to the bathroom every 2 hours, whether your bladder says so or not. It's also going to decrease the amount of buildup of urine in the bladder for nighttime. So try to get to the bladder every couple of hours. Avoid caffeine. That's going to stimulate the bladder to actually have spasms. You can also massage your bladder area after you've urinated to try to release more of the urine. And then there are also exercises called pelvic floor exercises that can be done to help to control bladder as opposed to using medications. Bowel control for Parkinson's, you kind of know the basics: water, fiber, your probiotics. Your diet really matters. One of my patients in particular swears by, and he tells everybody he runs into that he likes apple cider, and he says during fall, like we have right now, get that murky stuff. And he says just, freeze it if you have to, but he swears by apple cider. There are some medications that might be needed if you have problems with slow gut motility. Next slide, please. So some random pearls. Some people have off times, and I briefly described that before, where symptoms can kind of come back. And oftentimes we see this even early in the morning. So what do you do during that time? And people feel like their lives are regulated by their off times. Obviously, our goal in treatment is to try to get rid of those off times. But if you're having that, it's smart to not try to overdo it or necessarily push yourself through those off times. One of the things that people tend to have problems with, and not everybody, is double vision. So I tend to say, well, if you're having off times and you also have problems with double vision, there are some eye exercises that you can do to help increase the lateral eye muscle strength so that they converge in on one object and you don't see double anymore. So if you're sitting there in your chair, especially during commercials on TV, it's smart to do those eye exercises. And those require you to basically put your finger at arm's length and gradually bring it in and make yourself kind of go cross-eyed. And you do repetitions of that 10 times. And you're making those eye muscles work together so that there's not one that's weaker than the other. And over time, it takes time, just like any other muscle in your body. It takes time to strengthen it, but you will be able to lessen your double vision if you keep doing those eye exercises. Another option is hand exercises, and I won't go into that because I believe that therapy is going to cover that after I'm done talking today. But just doing hand exercises, it doesn't require a lot of effort, but it can definitely improve your handwriting and your hand dexterity. You can practice meditation, and I'm going to get into that a little bit in a little bit. Some other things you can do is reading, audiobooks, some brain games, but try to limit how much you're multitasking during that off time. And it might require you to let people know, hey, look, I'm tying my shoes right now. I really can't have a conversation right now. It's okay to let people know that. You may have to change your time of day that you normally do things to accommodate your Parkinson's, but that's okay. Another tip that I have for people is if you are wearing bifocal or trifocal lenses, please don't walk with them. Especially if you tend to be a person who looks at the floor when you're walking, especially upstairs or downstairs or off of curbs. Those bifocal or trifocal lenses will distort your depth perception, and they will make objects look closer. So you'll misstep and you'll definitely feel uneasy. Next step, please. Emotions. So what I wanted to kind of cover here is look into meditation. Anxiety, depression, and sleep disruption are part of Parkinson's disease, but it doesn't always require medication for it. Meditation is so key. Now, you guys are all coming from different areas, so I would say, find your resources, ask your providers about meditation resources. A lot of our hospitals offer programs as well, especially for chronic conditions. So seek those resources and start practicing and getting skilled. It takes time, but I guarantee you that it'll help with your sleep. It helps with anxiety, and it can help with depression as well. Next slide, please. Just like I said, meditation consider also vision boards if you feel like you wake up in the morning and or you're getting through those rough times. Vision boards can be helpful in spreading more of a positive message or remembering that you've gotten through this before, especially for those tough days, or what we call apocalyptic thinking. And it becomes very negative thinking, and your body will certainly follow your mind. There's also something called cognitive behavioral therapy. That's something I prescribe often, and it gives you tools to better deal with the obstacles that you're going through. And let's face it, we aren't really taught those in school, and they're not real easy to acquire. Next slide, please. At the Neuroscience Group, we have a memory care program. It's very in-depth. It is great in being able to assess different memory disorders. We have a neuropsychologist that works with us. We were able to put together a program and identify community resources for people. So I just wanted to kind of mention that one of the most difficult things for people as well as caregivers is managing declining memory. So just know that there are resources in the community for that. We have a very specific program that is set up to try to evaluate memory disorders as well as treat and then link you up with community resources as well, so that hopefully people remain independent in their home again. Next slide, please. So that about wraps it up. I think I'm going to open it up for any questions, if you don't mind.
Great job, Dacy. As always, that's just a ton of information in 40 minutes. So thank you so much. And just so folks know, this the presentations will be on our website in next week. So you can catch up on that if you want to watch it a second time, which I'm sure a lot of folks will. But we did get some questions. So let me bring some of those up. What options are available for genetic testing? My sister and I both have Parkinson's, and the environmental causes not truly relate to our situation. Mm-hmm. Thoughts on genetic testing?
Yeah, so genetic testing is usually done by a genetics team. There are some that we can order labs for through company, and but normally you really want some counseling to go along with that as well. So we tend to make a referral to genetics for that. There are times that there are certain labs that I can draw, in the office, but it's really best to have a kind of a team approach when it comes to genetics.
Great. What should we be looking for and asking when looking to transition possibly to long-term care, such as assisted living facilities?
So there are resources, again, through the Aging and Disability Resource Center. I always say there are checklists available, because you're right, there are a lot of questions that you should be asking. And there are also, the WPA has a great list of resources for agencies that help you get through that process as well. But you certainly want to acquire a checklist so that you have consistent questions and you're doing a kind of equal comparison when you are visiting. But I guess the biggest thing is word of mouth. Certainly word of mouth. What is their experience with Parkinson's disease or memory? And again, I think that the WPA is a great resource for that as well. For me, I tend to know my own community, mainly because I do a lot of training with certain programs or facilities. And so I kind of know which ones have really stuck their necks out to really know Parkinson's disease. And I've been able to really identify and also gain feedback from facilities that I really trust. So ask your provider because they know who's good at communicating. I have some facilities that, boy, I ask for, orthostatic blood pressures on somebody and a lot of feedback on a medication change I've made. And they're great about giving me a lot of information, and others where the crickets are chirping. So I know which ones I really trust with your care. And let's face it, that's a hard one, because you are giving up that control, and you know that person best. So that's a sensitive subject to me. And I think that between the WPA and their connections and me knowing my community and my connections, it's something, those are the two key resources.
Yeah, great advice. Staying local, to start local, and
Yeah.
then contact WPA. We welcome that as well.
Mhm.
So good advice. You suggested taking yogurt with meds. What about protein?
Yeah, and so it just depends, that's the dilemma that people have. Some people can't take crackers, and it's not going to really smooth things down. So anything that reduces, some people don't have a lot of problems with protein, and other people are more sensitive to it. So you kind of have to know whether or not that's something that you're more sensitive to. If you can do it with applesauce, some people just don't like applesauce. So
Right.
Be creative. If you can avoid protein, we definitely want you to avoid protein.
Okay. Somebody asks, have you worked with people who have postural challenges, for example, PISA syndrome? And if you have, maybe you can define what that is for folks who don't know.
So yeah, definitely. Obviously, it's not something that is commonplace. And I think that there's so much education that needs to be given, just like there's other forms of Parkinsonism as well, that's something that is probably best covered in individual visits, because there's just so much information to give on it. But that actually becomes much more challenging. And all of us have certain challenges, whether it's memory problems or any of blood pressure changes that are challenges and make it even more difficult to treat. Memory changes, swallowing problems, hallucinations, things like that. So I think that that's why it's so key to have a movement disorder specialist who has a lot of insight into a few of these disorders that can be a bit more abnormal and not your stable course with Parkinson's disease, but certainly become challenging, especially for the patient in treatment and as well as the caregiver.
Great. Maybe one final question. For somebody newly diagnosed, and this is an area where WPA continues to really, it's such a crucial time, as you talked about in your talk, that very different reactions when you first get the news. But what resources do you like to provide to someone who is newly diagnosed with Parkinson's? What's really important?
Yeah, well, obviously, you guys know you give me packets, so I get packets from the Wisconsin folders from the Wisconsin Parkinson Association. I definitely give everybody my list of contraindicated medications for people with Parkinson's. I can't believe how many people I get in my clinic who have been diagnosed with Parkinson's for years and have no clue about this list of medicines to avoid. And it's so important and so easy to give out. So a lot of it's about linking people up with, I look at where they're coming from. I talk to them about where they are, link them up with their local support group. I give them the facilitators a name and phone number. I think that linking them clearly to the WPA and the website is important. And then luckily at the Neuroscience group, we have exercise groups, we have support groups. I mean, we have memory care program. I feel like we have so many great resources at my fingertips. Clearly, some of those aren't running right now due to COVID, but but we definitely have a lot of great resources. And you know what? There are resources everywhere. So those are some of the main resources that I use. And clearly, a lot of it for me has just been past experience. And like I kind of was trying to share with you today is feedback I've gotten even from other patients, because you know best on how you have managed Parkinson's disease. And if there's a conversation that's going on and I say, oh yeah, somebody else told me this, I love to be able to share that information and those tips with you on an individual basis.
Right. Well, Dacy, you are a fantastic resource for us in the Parkinson's community in Wisconsin. So thank you so much for your time. today, and we hope to see you in person pretty soon.
Sounds good. Thank you for having me. I appreciate it.
You bet.